What is up, YouTube? Today we're going to be talking about medical record data abstraction or patient record abstraction, clinical data abstraction, abstraction management. Basically, this is just taking verbiage or words and medical terminology out of the medical record that is really important for care. A lot of times, this information is transferred into bills. It is used in research purposes and used for data validation. And if you didn't see my last video on data validation, check out this card up here on the side of the screen on the right-hand side, and you can get right to that video. So, abstraction is really an important part of the medical record. You kind of gather information that can allow the patient to be cared for, their medical records can be billed, and the information can be used for research and quality care. Maybe to see where there are some areas or gaps that need to be filled in so that patients can get quality care. So, what is medical data abstraction? When you migrate from paperless records in a practice, or you take paper to electronic, a lot of times things need to be digitized in EHR, the electronic health record. So, that is taking our paper record and turning it into an electronic record so it can be easily tracked. So, how does abstraction work? Medical data abstraction requires manual data entry that is kind of relevant, that you really can collect electronically, things the computer cannot determine. And I am going to be doing an example of this a little bit later. So, if you hang around here, you'll see exactly what I'm talking about. You then enter the information that you abstract from a record in a predetermined field, and that field will then save and capture the relevant information that you're looking for, whether it's research information, validation information, quality outcomes, meaning how well you are actually caring for your patients and how well you are documenting the information. Last but not least, medical data to abstract typically happens to be like medical history, allergies, immunizations, current medications, growth charts, demographics, and historical procedures. So, depending on the type of abstraction you're doing, you will get into looking at charts and graphs, things that are important specifically for particular studies or for particular insurance companies, pulling out certain data like immunizations and reporting information like that, maybe to public health. So, you may have to abstract that information, you may have to scan a paper record in, and you may have to document this information in a specified field in order for the information to be captured properly. So, we're going to go in and look at the different types of data validation or data abstraction that you can do for validating information. And what we mean by validating it is that we're grabbing the information, putting it into a preset document inside of an electronic health record, and we're making sure it complies with rules and guidelines. So, in looking at these jobs here, you see a bunch of jobs here on the left-hand side. The one we're looking at in the center of the screen is cath, PCI, AFib. I happen to know that those are cardiovascular terms. So, if you're very good at those types of things like chest pain and abstracting that type of information, this might be the type of job that you're looking for. This is a remote job. You're abstracting information for a cardiac area. Another abstractor job we have here is maternal and neonatal. So if you're looking for a job in abstracting information from records, and as you see here, using the EMR, navigate in the electronic medical record. And this one in particular is looking for clinical experience, an RN or an LPN. Depending on the type of clinical data, normally if it's clinical data or focused on a particular area, they may require a nurse. So I would look for medical records abstractor and patient record abstractors if you are a certified coder or a coding abstractor, or if you're a medical assistant, or if you're looking to do this type of thing. This one is bariatric. So this is bariatric data abstraction job here. And we have 100% remote for this one as needed. They prefer a bachelor's, but it is not required. And the ability to pass the exam. So it doesn't look like this one requires any type of certification and 2 years of medical terminology. So that is another job. We also have one that is for a quality assurance abstractor, going to make sure that the data is valid and has great quality. Anatomy and basic midterm is a great one for this one. And it looks like it is a very good job here. So as you see on the left-hand side, there are a couple of these jobs available. And we have one that is GWTG. This is Get With the Guidelines, Heart Failure Clinical Data Abstractor. So they're looking for someone who knows clinical data abstracting guidelines. It's about $28 an hour. 1 year of abstracting preferred for this particular job. It's about $28 an hour. And they're looking for an active RN for this one, or a certified quality professional, somebody who has EMR or HIG experience. So let's take a look at some other jobs that we may have here with patient outcomes abstractor. So knowledge of understanding of pathways here with certain records and our patient. Encounters and aggregating information from patient encounters. This is also knowledge and understanding of guidelines. So this one is going to be more for a bachelor's or higher, someone who might be a medical student for abstractor. They meet all certain levels of abstractors. So let's look at one that is a medical abstractor. 2 years of auditing, knowledge of CMS, which happens to be guidelines for the Centers of Medicare and Medicaid, and one for an LPN. This one is high school or GED required. So you're really going to have to look through a lot of these. They're all different levels depending on how difficult they may be for data abstraction. This one is for a manager job. There's all different levels of these types of jobs. They have electronic health records, as you see at the bottom here, medical records representative, HIM specialist. So those are going to be some jobs in that area. Medical terminology necessary, or 1 year of medical terminology, assisting or training new employees, knowing those AHA guidelines. So when we're talking about AHA, we're talking about the American Heart Association. That one is very similar to the Get With the Guidelines. So are you ready with this data abstraction, patient records abstraction, and medical records? There are many different levels, as you can see, from GED and high school diploma with knowledge of medical term, to coders that they're looking for to be abstractors, to nurses and LPNs. So please take a look. We're going to go right into looking at some of these data abstraction activities. So here we are with the Get With the Guidelines. Remember earlier, I talked about Get With the Guidelines. This is a data abstraction course. If you're a certified coder, if you have medical terminology knowledge, if you're an LPN or a nurse, if you have knowledge of EKG, cardiovascular terminology, like atrial fibrillation, flutter and you understand these terms, this could be a great free course for you. That's right, another free course that I'm going to be sharing with you so that you can get an understanding of what data abstraction is like, medical records abstraction, or patient data abstraction. Please make sure you write these terms down as they all will generate slightly different jobs in abstraction based on your knowledge, your certification, and your education. So this is something that you can actually register for. I'm going to make sure I pin the link in the comments after this video so you can get to this course. Now I'm just going to go right in so you can see how we would do these data abstraction activities and how we would validate and document this information in the EHR, the electronic health record. As you can see on our screen, we are in a medical record in a cardiopulmonary arrest event. An event is something that takes place where you have to document when the hospital or facility is documenting patient care. If an outside facility is starting CPR or resuscitation during cardiopulmonary arrest, then it can be documented until the hospital gets involved. So that information has to be entered properly into the electronic health record.
Let's look at the recognition measures associated with the data gathered on this form. A unique aspect of the CPA form is that it is the only form to capture and measure certain recognition measures. Achievement of certain goals leads to official recognition by the American Heart Association. These measures are different based on the age of the patient. Here are the recognition measures for adult patients.
So just like with validation, you're going to be using certain measures, certain rules and guidelines, and this one is based on age. So based on the age and guidelines, whatever patient we have, we're going to document the information in the EHR or the electronic health records based on a certain guideline.
Take a moment to review these measures, then click Continue. Here are the achievement measures for These are the achievement measures for newly born patients. Now let's look at the ARC form. This form is for patients who experience an acute respiratory compromise event. Please note.
So in this particular area, it's not just cardiopulmonary, it's cardiac and pulmonary, I should say, meaning heart and lungs. So that also would need to be documented as far as the patient's record. So if you're very good at cardiovascular and you're good at pulmonary, this may be for you.
In this section, we will walk through some example clinical scenarios, similar to what you will encounter when abstracting data. Ashley Johnson is a Black 54-year-old widow with 2 teenage daughters. Read over this background information and then click Continue. This list of events has been recorded starting with her admission to the emergency room. Please read through it to become familiar with her medical background, then click Continue.
So what we're looking for is an event that takes place. We could be looking for cardiopulmonary resuscitation. As you see here, we have pulseless, we have CPR. Those are the types of things we'll be looking for.
Now let's look at how to abstract this information. First, create a new patient record by clicking on the New Patient Record icon next to Resuscitation. Then fill out the system entry date and time using the 24-hour time values, along with the patient's date of birth. Once this information is complete, click Continue. Then create a patient ID. Remember, we cannot use anything in this ID that could identify the actual patient at a later time. The first tab is for the demographics information.
Remember, the demographics is the first name, last name, date of birth, anything that can identify the patient. So this is just a setup of that information of the patient. So we can then abstract data into this record that we just created so that it could be validated and follow the standard of CPR, the American Heart Association.
Gender and birth date are pre-populated from the data we previously entered. So we should choose Black or African American and not Hispanic. Then move to the Admission tab. Again, this tab has several things pre-populated at the top. As we scan through the data for fields that apply to an adult patient, we can see there's no weight documented in the data we have. We should either enter a 1 under CPC or PCPC scoring definitions. Let's take a quick look at the coding instructions to see why we would enter a 1 here. Here, you can see that
So in this is an example of the guidelines that you would follow to validate your information. You always have some sort of guidelines when you're doing validation. You're going to do guidelines and documentation, making sure that if you have some sort of code that you need to enter, you look at your documentation so you can continue your abstraction activities. So now we're going to go into looking at how this would actually look and what we would abstract if we were doing an actual abstraction ourselves. So we want to know, based on the patient record, which would be the system entry time for this patient. So we're looking for data that would tell us when the patient started some sort of cardiopulmonary resuscitation. When did this event start? So if we look at our records on the right-hand side, we're going to be choosing that time that the event would start. Now, for the sake of saving time, you would be told and directed as to what type of data validation you're doing. Again, this is the American Heart Association. I will put this course in a pinned comment in the comments, and I'll also put it in the description.
That is correct. The correct answer is A, 11:30. According to the coding instructions, when a hospital visitor or employee has an event within the facility campus, the system entry date and time is the same as the date and time of the event itself.
So remember, knowing coding instructions and knowing coding guidelines will be your friend. Now, you don't have to memorize them, but you really have to get used to referring to the guidelines. Every different type of data validation and data abstraction entering into EHR, they all have a method and they all have a workflow of how they need to be done. Let's do one more of these.
What would be the system entry time for this patient?
So if we're looking over to the right here, patient is found unconscious at the bus stop, CPR started by hospital staff, crash cart, AED, and EMS is called. EMS takes over the patient's care and they're admitted to the emergency department. So what are we going to do here? Not at 1520 because of the bus stop. Is it 1522 because of CPR started hospital staff?
That is correct. The correct answer is E. The patient would not be entered. Why is this patient excluded? The event began within the facility campus with response by facility first responders, but ongoing resuscitation was transferred to EMS personnel.
So this would be the type of information you would enter, the event information based on guidelines inside of EMR or EHR. So earlier we looked at Google, so make sure you go into Google and do some searching for jobs in your area. We have health information abstractor here. So that is another one. The only skill and requirement for this one is medical terminology. There's pre-certification coordinator, Again, something that requires medical terminology, verifying information to make sure it is correct and accurate. High school diploma with 2 years of job, customer service, billing, and knowledge of some coding. Here you see another job, data abstractor, medical terminology, data management, computer science, data mining, high school GED, and they're looking for people to get into this area. They're looking in certain areas, people who have some EMR or EHR experience that could kind of data mine and go through information, data management, computer science, or preferring other, and it says preferred very big. It's not required for this particular job. As you see here, they also have a coder abstractor. So if you're a coder and you know how to do that type of abstracting, outpatient codes abstractor. So these are just some of the titles. Emergency department charge abstractor, accurately extracts from information here. Let's see what you would need to do for this particular job. So abstracting based on CMS guidelines. So here's the theme. CMS, the Centers for Medicare and Medicaid Services, are having you kind of pull information out using their guidelines, 1 year of hospital experience and some knowledge of coding, coding certification preferred, but not required. We have last but not least a data abstractor job and qualifications, data management, transcription, or high school, GED required, 2 or more applicable years. So if you have data management, documentation, EMR, and EHR, if you've worked with bookkeeping or EMR systems, computerized systems, or you analyzed accounting data, that definitely could be applicable. So definitely looking for this particular company. They've posted this position just a couple of weeks ago, looking for a data abstractor and looking for someone who can work with EMR or EHR. Probably a great job for those who are looking to get into data abstraction and maybe even use medical billing and coding or EHR or EMR certifications. So we're going to get into a very specialized area of abstraction called HEDIS abstractor. Now, this is an always evolving area. This is a type of data set, healthcare effectiveness data and information set. It's a tool by healthcare organizations to measure their performance and evaluate patient care. Now, there's multiple areas of HEDIS. So based on who you're abstracting for, the type of medical facility will determine the type of abstraction you need. Now, Medicare actually gives you the tools that you need to do this, and they're always evolving with what? Guidelines, rules, things you need to validate and update. So you see that my last few videos have all been in and around data, abstracting it, comparing it, using guidelines, and using protocols. So let's get into talking a little bit about this HEDIS abstraction that is used for CMS, the Centers for Medicare and Medicaid Services. So why do HEDIS? HEDIS is for quality measures. It's a high priority for the Department of Health and Human Services and CMS, the Centers for Medicare and Medicaid Services, to strive to really give great patient care. They want to measure the quality of outcomes in a structured system, perceptions of the organization, what the patients think, how it relates to effective care, safe care, and efficient care. Also, that care is given in a timely manner. So these measurement management systems that were actually used are used to report certain types of information. CMS uses these quality measures for improvement of public reporting, pay for reporting programs, and it actually helps regulate cost and how much cost of healthcare should be. Overall, making sure that these quality measures are actually met by measuring them in different patient records in different medical facilities and hospitals. Along with CMS, HEDIS by the NCQA measures the quality of improving healthcare. So that's what they are doing with improving quality, making sure things are up to date and reported properly. You see here with the NCQA, this National Committee of Quality Assurance, making sure that there's quality, they have certifications. They talk about that HEDIS process that is regulated through Medicare. And there's also careers there if you want to look for any careers. Let's look at some of these HEDIS measures. So we're going to be looking at CMS contracts with HCQA. And what they do is they measure for special needs in certain plans. They measure significant like public health issues like cancer, heart disease, behavioral health, and diabetes. Really big focus on behavioral health. I'm seeing a whole bunch of these particular jobs for healthcare effectiveness to make sure we're pulling out and documenting this information in health records accurately. So we have colorectal cancer screenings, care for older adults, blood pressure, pharmacotherapy, which would be medications and drugs, spirometry testing and assessment of COPD, that's chronic obstructive pulmonary disease. That's a condition that makes it difficult to breathe. Osteoporosis, antidepressant management, follow up care, risk management. So these are some of the areas that we will see in our HEDIS measurements, and they do change and update yearly. Is a HEDIS coordinator job. And as a coordinator, maybe you don't necessarily need to do all of the HEDIS activities, but this one looks like you're going to be managing some information, um, coordinating activities as far as HEDIS review. This is a contract, sorting medical records so that they can be entered into the database using reports, faxing, high school diploma, MS Excel, data entry, typing, detail oriented. So definitely keep looking out for these types of jobs. Look up HEDIS coordinator, data abstracting assistant. Remember, data abstraction can be done in many different ways and forms by many different organizations on many different levels. If you would like me to do a video on how HEDIS is actually performed and what that looks like, let me know in the comments.